It is a well-known fact that tobacco kills thousands of people in the United States every year. Tobacco is sold at public locations like department, convenience, and grocery stores, all of which are completely susceptible to children. In the state of Kansas, it is illegal to sell full-strength beer and hard liquor in all of these places, but a drug that is equally as hazardous is sold and advertised in the face of our children. With later generations understanding the significance of this drug, there would be less subject to addiction and abuse. The state of Kansas should isolate tobacco sales to individual places of business, not allowing gas stations or grocery stores to sell cigarettes or tobacco products of any kind. It'd be easy for me to rattle off statistics about the 5.4 million people that die worldwide each year from tobacco, or the 15 years it takes off the average smoker's life. Info Research Lab published 2010. But these numbers are incomprehensible. The real devastation occurs when you are personally faced with a loss. Words cannot grasp what loved ones can miss in 15 years, or even longer if the last years are spent in a hospital bed. The quality of life for a terminally ill patient with esophagus or lung cancer has little quality at all. Education is the best defense, and if we stop putting our vices next to our groceries, more and more people will lean away from this harmful drug. Now, it's understood that you cannot stop everybody from smoking. This is a futile goal that would surely exhaust resources and achieve little results. We saw the same issue happen with Prohibition in the 1940s, and we're seeing it happen again today with marijuana. The idea is not to eradicate smoking as a whole, but just to separate the sales of tobacco the same way beer and hard alcohol sales are separated. The number of children under 18 using tobacco in the United States is staggering. Nearly 25% of U.S. high school students are smokers. Haynes in 2011. That number would drastically decrease if kids were not allowed in stores that tobacco was sold in, unless they were of age, as per current liquor laws. And with the reduced number of smokers, there would be a reduction in secondhand smoke and all other negative aspects that come with this addictive drug. Now, I can speak personally from experience when dealing with secondhand smoke. It is extremely unpleasing to sit in a car or restaurants with smokers. Growing up, both my parents in the house smoked cigarettes, and so did their parents. When I went to the grocery store, it was just another item on the list my mom had to buy. And that whole time, through secondhand smoke, I was being exposed to lung cancer, leukemia, also cancer of the throat, brain, bladder, stomach, and breast. This is all documented in studies by the California EPA back in 2007. Now, although I have been lucky enough to avoid such injuries, thousands have not been so lucky. Tobacco smoke contains around 70 cancer-causing agents, also known as carcinogens. And on top of that, the smoke that burns from the end of the cigarette has an even denser amount of carcinogens. This is published by the Cancer.org in 2011. When non-smokers inhale secondhand smoke, it's called involuntary smoking, which can be equally as dangerous as taking a drag off that same cigarette. If smokers were exiled out of the grocery store and the number of smokers decreased, it is a fact that the state's air and lungs would be cleaner. Tobacco sales blatantly kill thousands of adults and children every year. The state of Kansas has been a forefront on smoking policy and would be a great leader to start this trend. In fact, as per current Kansas law, if you have, say, 5 different people smoking in your establishment, you have to pay a separate fine for each smoker. A single violation could run you as much as $500 if you've been in trouble with smoking before. These are all outlined policies on kansasmokefree.org, no date given. Initiatives like this are the ones and the reasons that Kansas should be strong-heading this isolation policy. There's a legal epidemic on our hands. The government is taxing an addictive drug and making money off the calamities it brings. Kansas is in the right direction, but we have to push them through the door. In order to stop this epidemic, we must use policy to change the location of cigarette sales. If tobacco sales weren't behind a window that was right next to the candy at Walmart, fewer children would be curious to tempt this vice. If there were a stronger stigma against this deadly drug, less of the public would be smoking. And through education, we can achieve both of these things. When progress is seen, smokers will decrease at an exponential rate, as has been empirically proven through the last 10 years. This brings obvious health benefits to the thousands of children suffering from secondhand smoke at this very moment, and beyond that, the next generation of healthy adults who won't be taking said 15 years off of their lives. It seems as though through isolation tobacco sales would be a no-brainer, but because of stern policies and a rich minority, we lack to see this change. Although Kansas is taking the right direction, again, we need to push them through that door. In the state of Kansas, it's illegal to sell full-strength beer and hard liquor in places of business other than a completely designated liquor store. This reduces minors from contact, curiosity, and above all, addiction. If we built a better environment for our children to live in, they would grow into healthier adults, all which is possible through the isolation of tobacco sales.